Hi everyone, my name is Jennifer Buie, and today I will take you through the neurodevelopmental disorders found in the DSM-5 manual and also the DSM-5 Made Easy, as well as I will be explaining various characteristics, symptoms, and main criteria found in the Essentials of Psychiatric Diagnosis by Alan Francis. Enjoy. Next, we'll look at the overview of the neurodevelopmental disorders. So, neurodevelopmental disorders are a group of disorders in which the development of the central nervous system is disturbed. The disorder typically manifests during early infancy, childhood, or adolescence and is characterized by developmental deficits which affects the impairment of an individual's personal, social, academic, or occupational functioning. Please also keep in mind that the range of the developmental deficits can vary depending on the specified limitations of learning or control, which include the executive functions, self-regulation skills, global impairments of social skills, or intelligence. The neurodevelopmental disorders can co-occur together, which means if a child has been diagnosed with autism spectrum disorder, they can also be diagnosed with an intellectual disability or intellectual developmental disorder. Here is a list of neurodevelopmental disorders: autism spectrum disorder, intellectual disability or intellectual developmental disorder, borderline intellectual functioning, communication disorder, which includes language disorder, speech sound disorder, social communication disorder, and childhood onset fluency disorder, attention deficit hyperactivity disorder, the neurodevelopmental motor disorders, developmental coordination disorder, motor disorders, and also tic disorders, which we know as Tourette's disorder. So, autism spectrum disorder, or ASD. So, autism spectrum disorder is related to the brain development, which impacts how an individual perceives or socializes with others. This affects the process of social interaction, maintaining, developing, and understanding relationships. Additionally, along with the social communication deficits, the diagnosis of autism spectrum disorder requires the presence of restricted, repetitive patterns of behaviors, interests, or activities. Next, I will talk about the diagnostic criteria for ASD. Interesting fact about autism spectrum disorder, or ASD. Did you know that ASD was not recognized at all until Leo Kanner introduced the term early infantile autism in 1943. Next, I will be illustrating autism spectrum disorder. Autism spectrum disorder is a very common neurodevelopmental disorder. In 2020, the CDC reported that approximately 1 in 54 children in the U.S. is diagnosed with an autism spectrum disorder, or ASD. Boys are 4 times more likely to be diagnosed with autism than girls. As stated from the DSM-5 Made Easy, autism spectrum disorder, or ASD, is a heterogeneous neurodevelopmental disorder with widely varying degrees that has both a genetic and environmental causes. This is found in page 26. Some known statistical factors are 1 in 34 boys are identified with autism. 1 in 144 girls are identified with autism. Most children were still being diagnosed after age 4, though autism can be reliably diagnosed as early as age 2. In the next slides, I will go and describe thoroughly a diagnostic criteria as well as symptoms to better help our understanding. Signs and symptoms of autism spectrum disorder. Signs and symptoms of autism spectrum disorder presented by the CDC Centers for Disease Control and Prevention for autism spectrum disorder listed characterize developmental milestones or goals as it relates to possible factors to look out for. So the first one includes social, does not respond to name by age 12 months, avoids eye contact, prefers to play alone, does not share interests with others, has flat or inappropriate facial expressions, does not understand personal space or boundaries. Communication, delayed speech and language, repeats words or phrases over and over. Echolalia, reverses pronouns, says you instead of I, uses few or no gestures. Example, does not wave goodbye when leaving the classroom with the parent, does not pretend and play, does not pretend to feed the baby doll, or does not go over and play with dress-up clothes. And also there's another factor such as does not respond to gestures or does not respond to pointing. The next slide, I will also continue explaining the signs and symptoms of autism spectrums. Slides 7 and 8 are a continuation of various signs and symptoms to look for in children that may be exhibiting autism, maybe on the end of autism spectrum, or maybe showing signs of autism spectrum. So slide number 7, I included unusual interests and behaviors. The child may line up toys or other objects. The child may play with toys the same way every time, such as stacking blocks or stacking Legos. The child may get upset with minor things, such as a new friend may come over and try to go and play with the child during free play. The child may become obsessive over new interests or sometimes over the same interests, such as their favorite cartoon show or character. The child may show signs such as flapping of arms, hands, and rocks body or spin self in circles. And the child may have or show signs or difficulty to follow certain routines or patterns. Slide number 8 continues on with listing signs and symptoms from the Centers for Disease Control and Prevention of looking at red flags or maybe some signs or symptoms that your child or your child in your classroom may be showing signs of having the autism spectrum disorder. Slide number 8 is a continuation of signs and symptoms to look for of autism of children who may be on the autism spectrum. So symptoms may include but can vary hyperactivity. The child may go from one activity level to the other, such as they may go over and play with the sensory bags, and then from there they may go over and pet the guinea pig, classroom guinea pig, and then from there they may go down the slide. The child may also be very impulsive, show signs of aggression by hurting or harming themselves or others, may act out with temper tantrums, unusual eating or sleeping patterns observed, unusual mood or emotional behaviors. And lastly, the child may show symptoms or signs of lacking fear or that is more than expected. Next, I will go into detail the development and course. And this is from the DSM-5. The age and pattern of onset should be noted, as the symptoms are typically recognized during the second year of life. This is roughly around 12 to 24 months of age. However, onset of symptoms may exhibit as early as 12 months of age if developmental delays are severe, and late as 24 months if symptoms are more subtle. The next slides after that will detail the diagnostic criteria to follow. Associated features for autism spectrum disorder diagnosis. Features of autism spectrum disorder are persistent with impairment in reciprocal social communication and social interaction, criteria A, and restricted repetitive patterns of behavior, interests, or activities, criteria B. The individual may also, with this, these are present from early childhood and limit or impair everyday functioning, criteria C and D. Lastly, in order for a child to be diagnosed with ASD, the symptoms must fall into three broad categories listed from the DSM-5: communication, socialization, and motor behavior. The next slide will further explain the three characteristics or categories for an individual to be diagnosed according to the DSM-5 and also through the DSM-5 Made Easy. This slide, I will be talking about autism spectrum disorder and the symptoms retrieved from the DSM-5 Made Easy. Communication. The speech in patients with ASD may be delayed as much as by several years compared to others. The patient may speak loudly or may fail to use body language and or understand other nonverbal behavior in order to communicate. Next, socialization. The social maturation of patients with ASD occurs more slowly than the normal child. Example, the child may not make eye contact, may not smile when the parent smiles, or may not cuddle. The child may also not pick up their arms to be held, which is a nonverbal cue directed towards the parent and or caregiver. The child, due to the lack of communication, the child may demonstrate more temper tantrums as a result of frustration and or may become aggressive towards others or themselves. Motor behavior. The motor development typically arrives on time. However, it is the type of behavior that the child chooses to do that can be marked as different. This includes compulsive or ritualistic actions called stereotypes, such as twirling, rocking, hand flapping, head banging, and maintaining odd body composures. Autism spectrum disorder diagnostic criteria. Autism is known as a spectrum because there is a wide variation in the type and severity of the symptoms individuals experience. A. Persistent deficits in social communication and all social interactions across multiple contexts, as manifested by all of the following. Currently or historically, examples are illustrative, not exhaustive. See text. 1. Deficits in social emotional reciprocity, ranging, for example, from abnormal social approach, and failure of normal back and forth conversations to reduce sharing of interests, emotions, or affect failure to initiate or respond to social interactions. Autism Autism spectrum disorder diagnostic criteria continue. Number 2, deficits in nonverbal communicative behaviors used for social interaction ranging from, for example, from poorly integrated verbal and nonverbal communication to abnormalities in eye contact and body language, or deficits in understanding and use of gestures to a total lack of facial expressions and verbal communication. Number 3, deficits in developing, maintaining, and understanding relationships ranging from, for example, from difficulties adjusting behavior to suit various social contexts, to difficulties in sharing imaginative play or making friends, to absence of interest in peers. Autism spectrum disorder diagnostic criteria specify current severity. Severity is based on social communication impairments and restrictive repetitive patterns of behavior. Criteria B, restricted repetitive patterns of behavior, interests, or activities as manifested by at least 2 of the following, currently or by history. Examples are illustrative, not exhaustive. 1, stereotyped or repetitive motor movements, use of objects or speech, lining up toys or flipping objects. Echolalia, which means that after you go and state a sentence or a phrase, the child then states the same phrase in the same tone of voice. 2, insistence on calm sameness, inflexible adherence to routines or ritualized patterns of verbal or nonverbal behavior. 3, highly restricted, fixated interests that are abnormal in intensity or focus. Example, strong attachment to a preoccupation with unusual objects, excessively or very interested in different interests other than classmates their own age. Hyperactivity to sensory input or unusual entrance in sensory aspects of the environment. And you can also find and read more about specifying current severity found on page 50 for autism spectrum disorder. Autism spectrum disorder diagnostic criteria for criteria C, D, and E, which states criteria C, symptoms must be present in the early developmental period, but may not become fully manifested until social demands exceed limited capacities, or may be masked by learned strategies later in life. Criteria D, symptoms cause clinical significant impairment in social, occupational, or other impairment areas of current functioning. And criteria E, these disturbances are not better explained by intellectual disability, intellectual developmental disorder, or global developmental delay. Intellectual disability and autism spectrum disorder often times co-occur. Next, I will be discussing the comorbidity for slide 17. Comorbidity. Autism spectrum disorder is often associated with intellectual impairment and structural language disorder. Many individuals with ASD have psychiatric symptoms that do not form part of the diagnostic criteria for the disorder. 70% of individuals diagnosed with ASD may have one comorbid mental disorder. 40% of individuals may have two or more comorbid disorders. Slide 18 is centered on my references. I hope you enjoyed my PowerPoint presentation on the neurodevelopmental disorders. More importantly, I hope you learned more about the various disorders such as autism spectrum disorder. Bye.